Hello, I'm Dr. Bill Wyatt, and I'm going to cover another portion of an orthodontic thing. It comes up quite frequently, and that's rotation of teeth. But first, I'd like to tell you that I'm a general dentist who has done nothing but practice orthodontics for the last, well, since 1970, and that's over 40 years. Uh, I'm a member of the American Orthodontic Society. Now, this is a organization for general and pediatric dentists or any other dentist that's interested in orthodontics. And you don't even have to be a dentist to view these videos. If you're a dental assistant, you might want to do that also. But we're going to show all the different facets of orthodontics and fix it where you can really uh, learn it. Hopefully it will. And we're interested in the general dentist, the pediatrician doing some good orthodontics. I mean, some real good orthodontics. And that's what the sole purpose of this organization is, to teach general and pediatric dentists and other dentists if they're interested in orthodontics. So we hope that if you are doing orthodontics and you're not in a good organization, the American Orthodontic Society, I think, is the best place to go. We have a lot of good teachers and instructors that know what they're talking about, and will take you by the hand and carry you through orthodontics. You're not going to learn it in a few weekends, but you have to keep after it, and you can learn orthodontics. Now, I'm board certified in both the American Orthodontics and also the International Association of Orthodontics. So here's back to rotation of teeth. This is something that happens in almost every case you take on. There'll be some teeth that need to be rotated to line them up so that they hold the correct space in the arch, and a lot of good reasons for rotating the teeth. I'm going to show you a lady here that we have worked on and rotated her teeth. Let me see if I can get this back over here. And this very nice lady, and she doesn't have a real big orthodontic problem, but she's got a pretty badly rotated tooth, and it kind of messes up the situation to go in there and do real good orthodontics on it. Now, on the right side of the mouth, every case has a whole bunch of problems. I mean, this looks good, but it's class 2, you see. And she has a deep bite. Now, I'm going to draw on these, and I'll erase it and everything, but to show you, we're going to have to raise these teeth and depress these teeth right here. We usually do that with intruding arches, which we can pick these teeth up, the whole front part, and take this down back in here. Now, this molar really should be behind the lower molar. In other words, the lower molar really ought to be out here, something like that. And that would put these teeth out where they should be. This is kind of a class 2, division 2 out here in the front part of the mouth. So you correct that too while you're doing all the rest of this. And we'll either take this back some, but we're going to advance this also some on the bottom. And we'll put this point down into this point will go down here, this one here, and this one here, and consequently the lower arch will be a few millimeters further forward. You have to raise these teeth up and incline them out a little bit, and these will be inclined too when you get through with the case. You can kind of look at that. Now, just to erase that, we'll go to the next slide here, and shows the depth of the bite that comes in. You're going to have these upper front teeth up somewhere like the sort of this thing here. These teeth will be up something like that when we get through. Now this tooth looks like it's rotated, and this one is correctly rotated. Much better. That's not the one we're primarily interested in here, though. Now the other, the other side of the mouth. This is one I wanted to illustrate. It's a bicuspid, and it is looks like 90 degrees rotated. This is the buccal surface. That's the lingual surface. So we're going to have to turn it around 90 degrees in here. Then it'll take up less space in the arch. It won't crowd things up as bad. And this is a class 2 side also. Like this molar really should be out something like that. And so it's going to be a good bit of advancement of the mandible, and also taking the maxilla back to line this up. But usually this goes, and then class 2, division 2, you nearly always never take any teeth out at all. So you're going to keep everything you've got up here and finishing this case off. If you don't do orthodontics, don't jump on some kind of junk method of doing it. I think of doing orthodontics as working on an individual. I mean, it's like giving you a canvas of a human and go in there and do the very best you can to make that person look good and function properly. And that helps the temporomandibular joint back here by advancing the mandible. That gives you some freedom of the joint. These teeth that are locked back can cause TMJ problem, but there are plenty of people with them locked back that don't have TMJ problem, but you can certainly have that. Now, temporomandibular joint problems are in orthodontics, and to say that orthodontics has nothing to do with the temporomandibular joint or TMJ, you hear it all over, but that is a bunch of Tommy right. It is tangled up with it, and so is other parts of dentistry. So my feeling is that a dentist that's going to do anything with a mouth ought to understand an awful lot about the temporomandibular joint, because dentistry affects it, orthodontics affects it, oral surgery definitely affects it, especially where you section the jaw off and shorten it or lengthen it. You don't know where the darn condyle is going to be up in here, so you need to know something about the temporomandibular joint. Now, I've been working with TMJ cases along with the orthodontics for the last 25 years or so. Okay, let's go on looking at it from above. There are very few rotated teeth. This one's rotated right up here, you see. This will have to go out, and this will have to come in. And that's going to take up a little more room, see, and these will have to be torqued out, you see. So that'll give us room to torque the lower anterior teeth out also. And on these class 2 division 2s that are closed bite, and when you open the bite, nearly every one of them, the mandible wants to be further forward, and it'll come out. Your class 2 correction is usually not very difficult in the class 2 division 2 cases. I've had them that came all the way out. I mean, you didn't have to do any class 2 mechanics. Then I had one that I had to put class 3 elastics on it to finish it. Now, that's a rare thing. You don't have that much. It's class 2 when it started. It went to class 1 and then went on to slight class 3 before we finished. Okay, now on the bottom arch, here is the tooth that's nearly 90 degrees rotated, you see. This is a buccal surface, you can always tell. And so it needs to be rotated around, and this part right here will have to be in this direction. And we're going to show you a method of rotating the teeth that to me is the best way going. You can rotate darn near any tooth you want to. I mean, you can turn them around, and it doesn't take all year to do it either. I need to show you a little bit about rotating teeth before we get into this. So I'm gonna just make a white screen up here and say this is an arch wire, and you've got a bicuspid that's sitting in here like this. Then you have other, say maybe another bi over here and a molar back in this area right here. And you want to turn this tooth around. See, this is a buccal surface. So we're going to try to rotate it kind of like that, you see. You got an arch wire going along here. So we come in and half hitch an elastic chain. Now this is simple for some people to know, but some people have a real difficulty in getting it in their mind what happens in here. It's real simple. This is an elastic chain. It's not drawn real good. But we run a piece of dental floss, come off here, go through this and come back with dental floss. Now you stick the dental floss under the arch wire here, so it goes under the arch wire. Then you come back with the dental floss and you insert it into the little opening of the chain. Excuse me for this, I can't keep those from coming up. And you run the dental floss in this part. So these run in here, but you go under the arch wire. And now you pull on that, and that will pull this part of the elastic chain through this opening in the elastic chain on the other end. And the arch wire is in here. So when you get through, the elastic chain is half hitched onto the arch wire itself. Now you take your dental floss and you wrap it around. I wish this would quit coming up there. You wrap it around the tooth, come around over here, and if you can't put a bracket over here, but you put something we can catch hold of right here, and you hook this over that bracket or whatever you've got on the tooth, and it's like having a rope you put on the lawnmower to turn the wheel, and this is stretched out and it turns this tooth around like that. I'll get over here later and show you on the teeth and show you how we put that on. Now a lot of people just catch on to this. I mean, no problem at all. And then yet I've been teaching orthodontics for 40-something years to general dentists, pedodontists, or anybody. I've even had some orthodontists come and take some of this stuff. And some people are just absolutely can visualize what it is and they can do it without even half trying, and other people can be smart as all get out in certain areas, and it's very difficult for them to get this down. So if you're smart but you can't catch it right off, don't just keep at it. I mean, you can learn it. Now these doggone videos, I've got so many of them up here, but if you want to learn orthodontics, you can sit down and go over these and we'll show you everything I can think about. I don't have but about half of my lecture series on YouTube yet, but you can learn it, you know. And so this is going to cover, you know, rotating a tooth in here. So that's the tooth we're going to do. All right, here the tooth is. Now we've got this chain on here already. Now we've half hitched it right here, and you stretch it out with a dental floss. Go under the tooth, run your dental floss through the tooth over here, pop it down through, then pull this chain through here. That bird. Now, with the dental floss stretching this out, you see you pull it around here and take it and hook it on the bottom part of this bracket over on this side. Then you run your dental floss back under the arch wire over here and stretch it out, hook it on the other side. Do not hook the elastic chain over the arch wire here, or it won't do anything. See, you just have to pull on the arch wire. Now there's nothing holding this tooth to the arch wire except this stretched out chain that's coming through here. And you stretch this out. Now, some of these elastic chains lose their stretchability, if you want to call it that, in just a short time. Now, I'm not promoting any one company at all, but I understand Rocky Mountain has come out with some kind of elastic chain that lasts longer. And I don't get anything from Rocky Mountain, but they are a good company. And so you might try that if you're having trouble with the elastic chain you have either breaking or playing out or getting where it's just completely stretched out in 2 or 3 weeks. But you can put that on Ortho, and it'll turn a tooth around just, like nothing else will do. And when you get it around here, you might overcorrect it just slightly and then tie it to the arch wire. And I like to have my brackets a little off center so that I slightly overcorrect it because it'll tend to go back when you get through. Now there's one thing I didn't point out a while ago when I had this white screen up there. I'm going to go back again. Like if you're doing a bicuspid here and you come down here at the tip of that bicuspid and say your root ran into cortical bone and it turns out like this, then when you rotate this tooth, this has to spin all the way around in the bone. So it's going to take a lot longer and harder to rotate, and you could snap the nerve and blood vessel going into the tooth that way, but it's not likely if you're going to go slow with it. But if you have a bicuspid, say, set in here, and the root of it goes down to something like that, it'll turn around real easy. And the nerve and the blood vessel, if they're going into the tip of the root, your chances of breaking that nerve are just almost nil. Now, I've never cut one of them going around or either way in here, and I've rotated thousands of teeth, and I've been straightening teeth since 1956. And I don't know of any tooth that we've killed. They're killed and messed up the nerve in it over that period of time. But this is something you think about. If you got a crooked root, that's pretty rare to have one that crooked right there. Most of them, they may be slanted off a little bit, and that's not too bad. Okay, we'll go back to this. All right, it's hard to see what I did here. Now, if the tooth doesn't have a kind of a crown on it, and the elastic chain has a neck in it, and the elastic chain will go down and stay around that neck, it won't pop over there. But if you're starting to rotate a cuspid, it's something like this, and you put this chain around, frequently it'll slide over the top of it, and then it loses its ability. So we have to come in and put a slight amount of good composite, just something up like that with a groove in it, or put the thing down here further where you've got a little groove, and then you wrap your chain underneath that, and it won't come out from under the cuspid. So that's something to remember too if you're doing this. When you're doing this type of lecture, nobody asks any questions. So sometimes you forget some of the parts that are important, so I try to remember them as well as I can and cover them. Now this is a little closer. Just make sure when you come around the tooth and that you got to take this dental floss and pull it under, hook it on the bottom part and pull it back over, and then hook it on the top part of the bracket, you see. But don't run the elastic over the arch wire, or it will hold the tooth up here and it won't let it rotate, you see. So that's common sense, but it surprises you how many people will not be able to figure that out. And I'm not kicking on people studying orthodontics, but there's a lot of people just don't have a real knack for it. And I've had lots of smarter people than I am that have difficulty really learning orthodontics. Now here this is again, you can see how it's hooked onto this bracket, but this rubber, this elastic chain does not go over the arch wire. It's hooked on the arch wire here. And this stretching it out keeps the tooth up against the arch wire, and this right here will spin it around. And that is by far the best method of rotating a tooth. A badly rotated tooth really, this is something that really works. And so if you do any orthodontics, I'm telling you, you're going to have rotated teeth. Now some of them are very lightly rotated. You run your bracket off to the side and you tie it real tight, and it'll rotate a tooth. Or you have these wings on your brackets. Well, these are wings here. You can bend them out and they rotate the teeth, you see. Mild rotations aren't a big deal. Excuse me. But real bad ones are a pain, and if you don't know how to do it, it just is almost, you think it's impossible, and it really isn't. All right, we'll go on here. Here's the tooth. It's better now, but we'll continue going around with it. Now we've put it back on again. It's mostly rotated. When we get it around here, we'll have to get this arch wire into this bracket. That'll have to change. The root will have to come back up this way, you see, to get in there lined up real good. But it's still got about 20 or maybe 15 degrees of rotation to do. All right, here we are further on down the line. I'm just showing you this case because this is a case that, now this was a class 2 case, by the way, and it was a closed bite. Remember, these teeth were down here somewhere, and we've intruded these, and we've intruded these. And there's one thing, I've got some stuff in here on these intruding arch wires, and you can open the bite on anybody under the sun, and if you know how to do it, you won't increase their vertical. If you have a high angle case, you better know something about it before you get in there, or you send those cases out to somebody that knows something about it, If it's a high angle case and you increase the angle, and that makes them look bad. I mean, they can't get their lips together and their teeth show too much. It really screws up a beautiful facial structure by increasing the vertical. So if you open in a high angle case with a closed dental bite, you got to bond some blocks back here and you got to make them chew on that. And then you take the force off of that and pick up the teeth. And that won't open the bite. Skeletally, it won't open. It won't open the skeleton, but it will open the dental bite without opening the skeletal bite, and that's hard to do. And people that don't know anything about it, they don't have any foggy idea how to do that. And all these people doing this quick, crappy orthodontics, to me, very few of them, they jump in there, think they're going to get rich quick, and that's just a bunch of bull. They screw up a lot of cases, and feel kind of like an orthodontist not wanting them to do it. But you really can do it. But there's no dead reason for you not to learn it and learn how to do it right now. Get in the American Orthodontic Society. We have good seminars and good guys teaching them. And I did that for years, and we taught people how to do good orthodontics. We don't have our finger on them, so we're not sure what they do, but they can darn sure learn it correctly. And that's what we're interested in, the American Orthodontic Society. And I'm going to push them on every one of these lectures to get you into that if you can. You can be in Timbuktu and still belong to it. And you can come in and take seminars if you can afford it. Traveling around nowadays is pretty bad. All right, so we've corrected the class 2 problem. Everything's looking good, and I think we've got the tooth rotated now. And here's the upper arch. You see, it looks good. Got good torque in the upper anterior teeth, and they're elevated. The lower anterior teeth have a little space in them where they were crowded up before. And this tooth that was rotated 90 degrees or nearly is round pretty good now. And so when we put a retainer in, it's going to lock around that tooth, and it'll hold it there. And you can rotate a tooth. If you just turn it loose completely, it'll rotate back a good portion of it. Even the transeptal fibers in here, when you rotate the thing, they have a memory of about a year and a half that they'll turn the tooth after a long period of time, unless you go in and cut the tissue down here. Nobody likes to do that. So you hold them and maybe slightly over rotate them when you do that. Now here's the deal on the rectangular wire, you see. We hook it up here. You can see it in this picture. Comes around and hooks over the bracket. Now if you wear this, the darn way it's not going to turn this tooth in this direction. And I don't care how old you are, they used to come out and say, well, your teeth didn't move when you got over. That was the biggest bunch of bull. I mean, you can straighten somebody, I guess, as long as they are living. I do believe you can do it. And the teeth will move. And usually these older patients are better patients. But the only thing, they've got periodontally involved teeth, they've got root canals, they've got missing space and all kinds of stuff in an adult orthodontic. So it's a challenge, and I think that's a good way. I don't even enjoy doing simple ones anymore. You have to figure out a way to get it done, and you can do it. So I'm going to push doing complicated orthodontics, and a lot of the stuff we put up here is darn complicated, but you can do it. So this tooth is pretty well rotated now, and we'll hold it till we finish or get it a little over corrected. There it is again. Now I'm going to run through some slides. There we are on the way to doing it. Now I'm going to show you this. You cut off about 4 strands of this elastic chain. Run your dental floss through it. I went over this a while ago with you. You run the elastic chain through the floss. Then you take this in and you run it under the arch wire, see, and then run it back through this and pull on it, and it'll half hitch that thing right on to the arch wire. Now that's simple. There's a piece of chain and dental floss on it. Let me see if we go an arch. You run the dental floss under the arch wire. We come back through on the other side. Now we've gone under it, and we have the dental floss back over here now, and we're going to run it through the chain, and the arch wire's in the middle of this. We're trying to make this as simple as we possibly can. Not that the people looking at it are simple. I'm not trying to insult anybody, but hopefully, if you don't understand it, take this and go back and forth with it until you really see what this is. So now we run the floss through this chain. Now you've got it like that. Now we're going to pull on it. We pull on it again, and now we pull on it, and you're going to pull the chain back on itself. See the chain's going in there, and now it's what we call half-hitched. I don't know what you want to call it, but just get the chain tied to the arch wire. And now we're going to take this and wrap it around this tooth and come out and hook the chain on that, and it'll be pulling it in this direction. And that's the best way to rotate that I have ever run onto. And I've been doing this stuff for a long time, and that is the best thing I've ever come up on for rotations. Now we pop it through the gap. Now you take your floss, run it down in between the teeth. We're going to pull this under without going through the contact point, see? So we'll pull on that. Let me erase that, and I'll show you the next one. So we pull the chain through there. Now we pull it up further. Now we're going to come around and hook it to this bracket without running the chain over the top of that. I've got to stress that because people will do it regardless. I've had a whole class of people who would be trying to do this. I've been darned a pretty good percentage of them will come up and hook it on top of this. Well, your common sense, if this chain is pulling, it's just pulling on the arch wires. I'm trying to rotate the darn thing. So don't go up on the arch wire at all. Erase that. Just take this thing. You got to take your floss and come around and pull it tight, and you can hook the bottom and hook the bottom of it. Then you run your floss back under the arch wire, come up here and hook the top of it, you see. Now, it seems like it's a lot of work to rotate a tooth, but it is the best way going to rotate it. Now, see, now we're going to hook the bottom part. Now we carry that around. It's hard to pull that chain around without the dental floss on it. You get around here now, push this gun thing. You push it on here, and now you'll run the floss under the arch wire and come up and hook it on the top. And the chain will not be over the arch wire. There we go. We've got that. Now you pull the dental floss under the arch wire, pull it up on top, and pull it till it stretches over. And now you let it off and keep this thing under the bracket. And then you take your dental floss off, you can throw it away now. As long as you got a tooth here with a neck on it, where this won't slide over the top. If you got a cuspid, you got to put a hump back here to have a groove for this to fit in on a cuspid tooth or any sloping tooth. So you can put it on anything. All right, there it is on there. Now we slip the floss off of the thing. Take it off. Now it's sitting on there like that. Now that's pretty darn clear, and I hope you will learn how to do that. If you're doing orthodontics, learn how to rotate the teeth, because this takes up less space. And if you had the tooth turned this way, it'll be out here like that. It pushes something out of line when you do it. There's something goes. Most people's teeth fit. If they haven't had big rotted out filling and somebody filled it, the space in the arch closed up, it messes up the upper arch too. So that's one problem with adult orthodontics. You have to cope with that. So that's, I think I've got some more pictures. That's just a cuspid. Well, yeah, here's a cuspid there. See, we took composite and built a little deal back here that doesn't affect it. so that now I want to pull this tooth in this direction, you see. So we hook the half-hitch the chain over here, come around, and you're going to go over this. I would rather pull that, make that composite or down lower and run your chain down like this, come around and hook it over the bracket here without rotating. It'll turn this cuspid around. It'll turn any darn thing you want to around. Now this bicuspid, you'd have to come in, fill out something here so your rotating chain would fit in there too if it was rotated. And there's the chain again. You cut it off, run it down the arch wire, run it through the other end, pull it down on there. Here's a young lady. We're doing that too. And she's got a slightly rotated tooth. Now, you train people to do all the stuff that they legally can do. And I had when I was much younger, I had a rip-roaring orthodontic practice, and we operated maybe 7 chairs, and we did darn good orthodontics. We didn't, and you got people working for you that know how to do it. I had ladies that I sent 2 of them to hygiene school. They were hygienists. One of them still working for me. 40-something years she's been there. Now I've finally retired, but she's still there. It's Tricia Smith, and Tricia has bent more arch wires than most any orthodontist has bent. And she can teach dentists and hygienists and dental assistants, orthodontic assistants. And so if you want to get somebody to come teach you, you get hold of Tricia Smith. She's working with Dr. Worley now there in Hurst, Texas. And she'll fly in and help you over the weekend or when she's not working. And she knows it. So I recommend if you want to learn a lot. She builds most of the appliances we use. She and another one, Pam Durant, who's married now, has got a little arthritis. She's a hygienist also. And then we had a lot of just regular assistants that Rhythm or Cracker Jack. And they had a knack for this stuff. And you put it on there like that, pull it up, go around the tooth, hook it on there, and that's about it. And most of the elastic chain will stay rotating or pulling for a good while, but you may have to come back, change this elastic chain in 3 or 4 weeks or 5 weeks, and until you get one on that's still stretched. There we are. This is I'll show you a bunch of stuff, but it's all the same dirt stuff. See? All right, that was that lady finished over there. So I hope to goodness you will learn how to do that. Now this is just uprighting a tooth, you see, and this is a good thing. But I think I have a whole video on this stuff. I mean, this bar would be way down here. You put it up here. This tooth will come out. It won't even be close to this. It'll be back here when it gets up. Then you line it up, pull it. Somebody can come in with an impacted wisdom tooth like this. They don't, as long as they got room back here to put it on, I can set that thing up cheaper than they can go get it extracted. And that is a good tooth. Now this happens to be a second molar. And learn how to upright teeth. People do the dumbest things in uprighting these teeth, especially where they got deciduous teeth. Here the darn tooth is coming in underneath. I think I've got some video of that. This tooth will back out of that hole. It'll back out. Now the deciduous tooth may have the hole This distal root eaten off, it's still vital. Works good as a space maintainer instead. And learn how to upright teeth. And there's some videos on that. You can go in there. There's no reason now. Back when I was trying to learn this, it was difficult to go. You had to sneak into some lectures and try to find out what it was. And I had an uncle who was orthodontist, but he never did help me. uh, he did, and I had my stepmother work for one, and I stayed around his office and saw what he did a lot of times. And they didn't have any good stuff. They just labiolingual. They couldn't handle teeth that we can handle today. We can handle anything living and breathing that comes in during the year. And I didn't get a lot of use of TADs because they came in a little late in my practice. So learn how to rotate teeth. And this little video will teach you, and I don't mean to bore you to death with it, but you need to do it. So I'm going to close this video out, and we'll put it on YouTube. And the Lord willing, it'll go all over the blooming world, and people can learn it. So I'm going to stop this thing. Looks like it's still going.